All right, we are back with Dr. Benjamin Marcum from the Stephenville Medical and Surgical Center. Dr. Marcum, thank you again for joining us. We've been doing this for every other week for a couple of months now, and we really appreciate you coming on to KTRL and KXTR.
Really glad to be back.
Yeah, and I kind of wanted to just get things started off this week and just get an update from you about kind of your view of how things are going in Stephenville and Erath with COVID-19.
Well, certainly we've had a marked increase in the number of cases over the last few weeks. It seems to be that the numbers are plateauing a bit. I kind of hope that maybe perhaps the governor's measures have taken a little bit of effect, and perhaps some people have been a little bit more cognizant about trying to protect themselves when they're out and about shopping and protecting other people by wearing masks and washing their hands and those kinds of things. It looks like it's perhaps making a little bit of an impact over the last few days. I think we're going to continue to see cases, obviously, throughout the rest of the summer and into the fall and throughout the next year. But if we can keep it at kind of the current rate, then our hospital systems will be absolutely able to handle the load. And so far, we haven't even come close in Erath County or with our supporting hospitals from the Metroplex to not being able to handle what we've been presented with. So That's encouraging news.
Yeah, absolutely. And you brought this up a little bit, but since the last time we spoke, masks are now required here in Texas. And although there are a few places that are not requiring them, just different areas here in Texas, here in Stephenville, I will say I've noticed that people do seem to be wearing masks, which is a good sign.
Yeah, it's a good sign. I think for the most part, people are. It kind of depends on where you go and when you're out and about. I've seen quite a few people not, obviously, also. So, it's it's surprising to me that it's such a hot topic or such a hot button issue for so many people. It really kind of took us all by surprise that so many people feel so strongly about it one way or the other. I think the evidence is there that it definitely helps prevent the spread. It's not going to stop all the cases of COVID.
Yeah.
It's going to decrease the disease burden in a population.
Yeah.
And what I mean by that is, if you think about everybody running around without masks, if you mark that disease burden of those respiratory droplets floating around in, say, a grocery store as 100%, if everybody adopts masks, that disease burden in that grocery store drops precipitously, and people don't come into contact with near as many infected respiratory droplets, and the infection rate is much, much lower. So, while we're not going to completely stop COVID by wearing masks, we're going to slow it way, way down. So those of you who are wearing them, thank you so much. Keep it up. Those of you who are not, I encourage you to reconsider so that we can try to slow this thing down and keep that trickle of cases coming so that we're not overwhelmed.
Yeah, and that's the goal, right, is obviously
Absolutely.
Not going to stop it, but slowing it down for hospitals and, just for everybody's sake.
Right.
And, I've heard in a few places, including like the New York Times podcast and a few other places, that children are not very good transmitters of COVID-19. Do you think, with schools supposed to be opening back up potentially, that means that teachers and children in those younger grades might be a little safer in the classroom?
Well, gosh, I hope so. All of the evidence we have for this virus is preliminary. For you to consider evidence as what we would think is like medical canon, like being, inviolate, we would have to have multiple studies with a bunch of different people.
Yeah.
Early indications are that, children, first of all, don't get that sick, which is good news. And hopefully don't replicate the virus at the same levels that middle-aged and older adults do. Mm-hmm. And so I sure hope that pans out throughout the fall when school starts back in, but we're just not going to know until it happens.
Yeah.
But it is encouraging news, and I hope it's something we can hang our hats on this fall.
Yeah, absolutely. And, this next question is something I'm sure you have dealt with yourself. But, my wife is a kindergarten teacher here in town, and I have a son who is going into kindergarten, but also have a 2-month-old at home who will be being kept by an older individual. Do you see a serious risk there? And what precautions can frontline workers like yourself and then, teachers and other people take as they get home at the end of the day to limit the spread to children and older people in the home?
Right, that's a really good question. My wife and I have had this same discussion because we're in the same boat. We have a son also getting ready to go to kindergarten.
Yeah.
And we have an older daughter.
Okay.
He's already been in the school system, but we've had this discussion on and off for the last few days about what our fall is going to look like, what our plans are looking like, and we've been discussing with teachers and employees of the ISD. The TEA just came out with some recommendations about how to have school as safely as possible, and some things. They all make sense. All of the TEA's recommendations make sense, but gosh, school is not going to look anything like what it looked like a year ago.
Yeah,
it's just going to be really interesting. But to answer your question, those measures that we've already talked about, wearing masks, washing hands. When I spend an afternoon testing patients in the COVID tent out behind the clinic, first thing I do when I go home is go put my clothes in the washing machine and jump in the shower. Just so that I'm not increasing disease burden in my home. And trying to protect my family members from the exposures that I might bring home from work. And so, I think in the schools we're going to try to get kids to wear masks. And parents, I think you ought to get your kids practicing wearing those masks now.
And that was Dr. Benjamin Marcum from the Stephenville Medical and Surgical Center. We'll have more with Dr. Marcum in 2 weeks from now, and we appreciate him joining us. And in 2 weeks, we'll talk more about COVID-19 and everything going on here in Stephenville and the surrounding area. You can find our interviews with Dr. Marcum and more coverage of COVID-19 by searching for Tarleton Radio Network wherever you get your podcast. You can also listen online anytime at tarletonradio.com.